After a meal with carbohydrate, much of what you digest arrives in your blood as this: glucose, a simple sugar and one of the body's main sources of usable fuel. After a meal, carbohydrate is broken down, absorbed, and glucose flows into your bloodstream. Blood sugar rises. That rise is normal. And one of the simplest ways to change that is a short walk. Your pancreas senses the rise and releases insulin, a hormone that acts as a signal. Insulin travels to your muscle cells and binds to receptors on their surface. That binding sends a message inward, and glucose transporters are moved to the cell surface. Glucose flows in, and blood sugar comes back down. Those transporters are called GLUT4, the doors glucose comes through. Insulin's job is to signal the cell to bring them to the surface. But in insulin resistance, the cell responds less effectively. The signal arrives and less happens. Glucose stays in the bloodstream longer than it should. So the pancreas compensates, releasing more insulin, sometimes much more, to try to keep glucose in range. At first, more insulin may keep glucose controlled. As resistance progresses, both insulin and post-meal glucose can rise. Over time, some people can no longer produce enough insulin to compensate. So the useful question is, what can you actually change? You get up from the table, and your muscles start to contract. Contraction itself triggers a second pathway inside the muscle cell, one that doesn't depend on insulin. The same GLUT4 transporters move to the surface, but now the contraction is driving the signal, not insulin. Once inside the muscle, that glucose can be used for energy or stored for later. Two different signals can recruit the same transporter. Walking uses the route that relies far less on insulin. Same meal. Sit still and glucose may rise higher. Walk afterward and that rise can be smaller. Contract. Bring the doors to the surface, take the glucose in, use it or store it. Which raises the practical question. You don't need a workout. Research suggests even around 10 to 15 minutes of easy walking after a meal can improve the glucose response. Timing matters too. Research generally favors walking soon after eating, while glucose is beginning to rise. The pace doesn't have to be intense. Even comfortable walking activates contracting muscle and can help moderate the post-meal rise. For post-meal glucose, several short walks after meals may work better. This is better than saving it all for one longer session. The benefit also outlasts the walk itself. After activity, muscle tends to respond to insulin more readily. Insulin sensitivity can stay improved for roughly a day or two afterwards, though the duration varies. The more muscle you recruit as you move, the more tissue takes glucose up. Even breaking up long periods of sitting with brief bouts of movement can reduce post-meal glucose and insulin responses. Glucose is relevant well beyond diabetes. In prediabetes, in insulin resistance, and in pregnancy, where it's often monitored closely. But you should also know what a walk is not. It is not a replacement for prescribed treatment. Walking is an addition to your management plan, not a substitute for it. It doesn't cancel the meal. A short walk changes the shape of the glucose curve. It doesn't undo what was eaten. And response varies a great deal between people, between meals, and between days. Your own numbers are the ones that count. Most of the strongest evidence here is about the post-meal glucose response. If you take insulin or a sulfonylurea, activity after meals can increase the risk of low blood sugar. If you have reduced sensation in your feet, check them regularly and wear properly fitting shoes. And stop and seek medical advice for chest pain, dizziness, or symptoms of low blood sugar. Never adjust your medication on your own. Get individual advice before making changes. Walking doesn't add anything to your body. It uses a pathway you already have. 10 minutes of movement, while your muscles are ready to take it in.